Hello, I'm Dr. Brandt Gibson, and I'm excited tonight to be with you and to talk again about bunions. So, as we talked about, a bunion is a prominence of the first metatarsal where it actually curves out and the toe curves in. You get this prominence, you get bony growth over this, you get pretty significant pain, pretty significant discomfort. We also talked about hallux limitus, which could be described as a dorsal bunion where this is prominent and you're banging into it as you walk. So, the idea here is, what are the at-home treatments? What things can you do at home to treat your bunion before you go see the doctor? So that's where we're going to start here. So you've got a bunion, you got a prominence, got a big issue there. And so the question is, what kind of things can you do at home? There's really several options here. One of the options is padding. You could actually do things like moleskin on this so it doesn't rub in the shoes, or you can use padding like a gel pad or bunion sleeve or something like that. Basically something that takes the pressure off that bony prominence so it's not rubbing on shoes. Number two, you can buy wider fitting or more comfortable shoes to take the pressure off, and that actually helps quite a bit. That limits pressure, limits problems, limits pain. Number three, you can use anti-inflammatories, non-steroid anti-inflammatory medications like Motrin or Advil or Aleve. Basically anything that's going to decrease the inflammation, decrease the swelling in that joint. You can also use warm soaks or ice packs. You can try whirlpools or baths. You can do massage. All of those things, basically you're decreasing pain, decreasing swelling, decreasing symptoms. And that's a lot of times what you're doing in that case. The next option is, if you are to decrease your weight, you're going to find improvement. A healthy weight will reduce the pressure across the bunion, reduce the problems in that way as well. There are splints and some of those kind of things that can be used. You want to be careful with that. Some of the splints create abnormal pressure in other areas that can cause other injuries. So you want to be careful, but there are splints that can do that. There's also spacers you can place between the toes to take the pressure off. So when you've got the bone turned out and the toe turned in, if you put a spacer here, it pushes that toe out, and that makes it so this is bony prominence is not as prominent. And that's really the best options. You'll have people that will tell you, okay, you can go get it arch supports or inserts from Walmart or something like that, and they can help. The truth is, if they really adjust the way you're walking, they are helpful. If they don't adjust the way they're walking, they increase pressure in the shoes and can cause other issues. Orthotics we have found to be very, very valuable and very helpful, as we've talked about previously, but the best is something that actually is going to modify the way your foot is functioning to put you back in a neutral position, so you're not putting as much pressure across that joint and across that toe. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 245. I believe I even have a graphic for that. Nope, it's wrong though. Never mind, we don't have a graphic for that. So this is bunion, and the idea is, what can you do at home? Day number 245. This is Dr. Brandt Gibson.